My illness started in 2009, and it started off with a problem in my eye. I just had a sore eye, and then I was sent to a rheumatologist where she diagnosed Behcet's disease, which is an autoimmune disease which affects all parts of your body. Anything that has a blood supply can be affected, and the areas that I have that are affected are my lungs, my brain. I get ulcers. All my joints are affected, and I spend a lot of time in hospital. I've had 50 admissions, about 7 ICU admissions, and I've been ventilated about 4 or 5 times. I first heard of palliative care when I was working at Children's Hospital, but that was really then only for children in the last week or so before they died. But now it's changed a lot, because when my doctor sent me off to see a palliative care doctor, and I thought, this will be interesting, I wonder what this will offer. And she was wonderful, and she said, I'm really looking at you for pain management, symptom control, nausea and vomiting control. And that's when Bernie came in as well, and she's wonderful, and she sort of goes through all of those things when she sees me, and she has lots of suggestions, and she can also liaise with my doctor as well to see what the problem is and what options we can do. It's wonderful. I couldn't stay out of hospital because I can't see, I can't do my own medication, and I can't do the injections. My daughter Melanie can do it, but it's very constricting for her to have to do it all time, every day, all the time.
It's really helpful, and it takes the burden and the stress off of the medical care side of things, so that I can really focus on what she needs during the day. So I help her with getting meals, and also moving around the house, taking her to appointments, and things like that. But yeah, mostly being in the house in case she has a fall or a seizure. Or we've had a couple of times where Bernie or another nurse has said that she's not looking well, so we need to probably admit her to the hospital, and so they've been able to phone ahead and coordinate with her doctor or with hospital in the home to facilitate that, which has been a huge help and meant that Mum has gotten the care that she needs more quickly than if we had organised everything. So. And they really do become part of the family, and you sort of, it's really nice to see them come in, and you're like, oh, they're here, and yeah, it's always really nice to see them and catch up with them.
I'm okay. I don't feel good, but I'm okay. I'm very tired, which I always complain of. I constantly complain, and I think maybe I've just got to stop complaining and say I feel good, and then maybe I'll think I feel good. I don't fear dying. I've got a husband that's a neonatal intensive care doctor, so we talk about dying a lot. It's something that we talk about while we have dinner, and he talks about babies that he's not going to be seeing tomorrow and things like that. So it's something that we do talk about a lot.